Are you thinking about changing your Medicare supplement plan, but you're worried about answering health questions to do so?
I don't like answering questions.
It is a common concern, and today we are here to clear up some myths and guide you through the medical underwriting process step by step. In our previous video, we explored the unique opportunities available to change from one Medigap plan to another without considering your current health status. Now, although that is great news for many of you watching this, what happens if you are past your one-time 6-month open enrollment period, and what happens if you don't qualify for guaranteed issue rights? That is where the medical underwriting process comes into play.
It sounds overwhelming and terrifying.
But it does not have to be. Today, we will explain exactly what the medical underwriting process entails, who it affects, and how you can successfully navigate this to secure Medigap coverage that fits your needs. As a reminder, my name is Cameron Giardini, and I help operate our independent Medicare-focused insurance agency, Giardini Medicare. If you want us to help you find and enroll in Medicare Advantage or Medigap coverage, please make sure to connect with us by going to our website, gmedicareteam.com, or just give us a call at the number you can see. First, we want to clear up some misconceptions regarding the impact of pre-existing health conditions when it comes from changing from one Medigap plan to another. Much of this confusion comes from the fact that the Affordable Care Act, or Obamacare, it made it so that marketplace health insurance plans, they can't deny you coverage based on your health, but this does not apply to Medicare supplement plans. In fact, according to the official Choosing a Medigap policy guidebook, outside of your Medigap open enrollment period, if you do not have access to guaranteed issue rights, as we discussed again in our last video, a Medigap company can, in fact, deny you a policy if you don't meet their health requirements and underwriting standards. Let's just take a step back and talk about the basics, which is medical underwriting. This is the process that an insurance company uses to decide, based on your medical history, whether to take your application for insurance, whether to add a waiting period for pre-existing conditions, and also how much to charge you for that insurance. Simply put, medical underwriting involves you answering specific health questions created by a Medigap insurance company about your recent medical history, your current health situation, as well as your habits such as tobacco usage. Now, this is done to decide if they will approve or deny your application, as well as what they will charge you for that plan. So throughout this video, when we say underwriting, just think health questions. Now, there is a common misconception on social media and online that navigating through this medical underwriting process is very difficult, making it nearly impossible to change from one Medigap plan to another. So let's just address this head on. Now, while it is true that medical underwriting can be a barrier to changing Medigap plans, it does not have to be an insurmountable one. Every year, many thousands of Medigap members successfully transition to new plans, provided they do meet the different health criteria. Now, before discussing this specific criteria, let's talk about which plans you may be eligible for and when you can make changes to your Medigap coverage. Deciding which Medigap plans you are eligible to apply for using the underwriting process, it will depend on when you first became eligible for Medicare. So for those of you watching who are newly eligible for Medicare on or after January 1st, 2020, it is important to note that you are not eligible to enroll in plans like Plan C or Plan F, which you can see those plans here on the chart from the Medicare and You guidebook. Thankfully, if you're watching this video and you're not eligible for Medigap Plan F or Plan C, you can instead apply for a Medigap Plan G or Plan N. These are excellent options, and really, in our opinion, they provide a better value than either the Plan F or the Plan C. So of course, make sure to watch our Plan G versus Plan N video after this one. Let's move on to timing and talk about when you can try to change from one Medigap plan to another. One of the significant benefits of this medical underwriting process is that there is no set enrollment period for when it occurs. You can answer health questions and apply for a new Medigap plan any day of the year, 365 days of the year. The ability to apply anytime provides a unique opportunity to reassess your coverage as your needs evolve or even as new plans become available. For example, maybe you watched our Plan N versus Plan G video and now you want to switch from Plan G to Plan N or vice versa from Plan N to Plan G. Now you can make this change any time of the year if you can qualify for the new plan. Or something that has been common this year in 2024, unfortunately, is maybe you have received a large premium premium increase notice from your current Medigap plan, and you simply want to consider a different plan, even if it's the same plan letter, but with a different company at a lower monthly premium for that same coverage. Now, when it comes to actually changing your Medigap coverage and navigating the different health questions and underwriting requirements for the dozens of different insurance companies, getting help from an independent broker becomes invaluable. We will help you very quickly understand the various coverage details of the different Medigap plan letters and help you easily find and compare the actual monthly premiums for the many insurance companies offering Medigap plans in your zip code. Now, although you can also do this by going to medicare.gov or using other sources we have discussed in past videos, what is not as simple is finding the different health questions and underwriting standards for the different insurance companies. Trying to find these different requirements, it simply ranges from being difficult all the way to impossible when you're using official sources like medicare.gov or simply looking on Google. Let's go over some quick examples of these differences in these health questions so you can better understand how these different insurance company requirements can vary. Then shortly we will go through an example of a full list of health questions for an actual Medigap plan application so that you can better understand all of the details that go into the term of health questions. So of course, make sure to stick around for that, and please, while you're at it, do not forget to like this video and subscribe to our channel for future videos. First, Medigap insurance companies will each likely have different lists of prescription medications, often called a declinable drug list. Now, these lists, they provide a full list of medications and the medical conditions that the new Medigap insurance company will likely deny your application for if you are currently prescribed one of the listed medications. Now, to see what I'm talking about, here on the screen you can see an example of a couple different declinable drug lists from large Medigap insurance companies. In addition to these declinable drug lists, different Medigap insurance companies, they will likely have different standards for acceptance based on your height and weight ranges. Here you can also see some of the different height and weight charts that vary from one company to the next. Perhaps most importantly, different insurance companies, they will also have different acceptance standards for specific health conditions. For example, here you can see an actual application for a Medigap company that will deny your application for a Medigap plan if you have been medically diagnosed with, treated for, or had surgery for COPD. However, if we look at a different application from a different Medigap insurance company, we can instead see that they do not specifically ask about COPD. Instead, they ask, within the past 24 months, have you been medically diagnosed, treated, or had surgery for any lung or respiratory disorder requiring the use of a nebulizer or oxygen, or 3 or more medications for lung or respiratory disorder. So with this company, it is possible to pass underwriting and be approved for a Medigap plan if you have COPD, as long as you meet the other specific requirements I just mentioned. Another common example of health question differences between Medigap companies can be seen in how their look-back timelines for certain conditions like cancer vary from one to the next. Now, as you can see here, this insurance company will likely deny your application if you have been treated for or been advised by a physician to have treatment for internal cancer in the last 2 years, while this application from another company asks essentially the same question, but within the past 3 years instead. So for example, this could make a difference if you are 2.5 years out from your last cancer treatments. Of course, these are just a couple examples of how the underwriting requirements can vary from one company to the next, but just know there are many more examples just like this. So of course, make sure to reach out to us or another independent broker that can help you navigate this process. We will provide a link in the description below so that you can connect with an agent licensed in your state. Now let's bring things together by talking about what the actual process of changing Medigap plans through the underwriting process looks like from start to finish. First, we help you see if it even makes sense to change from one Medigap plan to another in the first place. For example, if you are currently enrolled in a Medigap Plan N with Company X for $150 per month, and then we find that Plan N with Company Y is $145 per month, it can be very tempting to want to make the switch since, as we have mentioned in other videos, Medigap plans, they are standardized by their plan letter. So in this case, both the Plan Ns with Company X and Company Y provide the same basic coverage benefits. But like we have also discussed in other videos, please don't forget to think long term when it comes to Medigap Medigap premiums, unless of course you live in a state with more lenient rules about changing Medigap plans like we talked about in our previous video. Also, like we previously mentioned, remember some Medigap plans, they will charge a one-time application fee of roughly $25 when you're applying for a new plan. Think of changing Medigap plans as a game of musical chairs, if you will. As long as you are healthy enough to pass underwriting, you can change to a new Medigap plan, or chair, virtually at any time. But as soon as the music stops and your health no longer allows you to qualify for a new Medigap plan, depending on the state you live in, you could be stuck with that Medigap plan and company for the remainder of your time on Medicare. It's not to scare you, but it is to say that if you decide to change to a new Medigap plan with a new company, please make sure you are comfortable with that new plan and company for the long haul and not just based on relatively small premium savings in the short term. To understand the details of what to look for when considering different Medigap insurance companies, you should watch this video. If we do go through your options and you feel it makes sense to change to a new Medigap plan based on the new coverage or the premium savings with the new company, then we move on to the pre-screening portion of the application process. Now, different brokers will likely have their own version of this process, but here at Giardini Medicare, this involves reviewing your current health status and medications first. Now, we streamline this process by using this online form that you can see here on the screen, and we will also, of course, link to it in the description below. This form will ask you for the essential information that we need to determine which company could be right for you based on your current health status. This will help us check the declinable medication list that we mentioned earlier. It will help us check with the different companies' health questions to see which matches your unique health status and pre-existing conditions. Completing this form, it is not your application for new coverage. Like I mentioned, instead it helps us determine if you will likely qualify for a new Medigap plan. More importantly, it will help us narrow down specific plan options based on your unique needs. Following the pre-screening process, we would then help you fill out the specific online application for the new Medigap company. The most important part of this application process will be asking you the specific health questions from the specific application with the new Medigap plan you're applying for. Here on the screen, you can see every specific health question that is asked by this Medigap company to give you a better real-world example of what you might be able to expect. Of course, these questions will be different from one company to the next, but this will give you a better idea of what the average Medigap company might ask you. Also, in addition to these health questions, when filling out the actual application, you will likely be asked about prescriptions, physicians you have seen in the recent past, as well as other personal information like your Medicare ID number, social security number, and a form of payment like a bank routing and account number. Again, it is important to answer these questions honestly and to the best of your ability. If you are not sure how to answer a question, we can always call the insurance company before submitting the application to clarify their specific health criteria. The most important thing is being honest. Medigap plans, they do have what is called a contestability period, typically for 2 years, even after your policy is approved. When this happens, if a company comes back and finds that you purposely withheld or lied about information related to your health on the application, the policy could be terminated or they could simply deny your coverage. Also, like we will mention shortly, insurance companies will compare your application answers to online records, so they can and will likely find information even if you withhold it. After going through the full application together, if everything looks good health-wise and you want to submit the application, we will send you the completed electronic application for you to review and electronically sign. Now, once you sign it, then the application would be submitted directly to the insurance company electronically, and then it will be up to them to make the ultimate decision about your application approval or denial. Although this application process can sound long, just know that everything we just discussed, it should take no more than about 30 to 40 minutes in real life. Now, before finishing this video by discussing the possible outcomes of this underwriting process, make sure you remember a very important fact. Do not cancel your current Medigap plan until you're fully approved for coverage by the new Medigap company you are applying for coverage with, and you are sure you want to change to that new plan. We will highlight this cancellation process shortly. In recent years, it has become increasingly popular for Medigap insurance companies to use the services of a third party like Milliman to compare the answers on your application with Milliman's historical database of medical claims and prescription drug records that they have on file for millions of people. The benefit of this process is that it allows insurance companies to use a process often called automated underwriting. This means that once your application is submitted, a decision will likely be given within a few minutes. This initial decision will either usually be that you are approved for the coverage, denied the coverage, or that your application for the Medigap plan needs more review time due to differences between your application and the records that Milliman has on file. If your application needs more review, the employees in the underwriting department of the Medigap insurance company you're applying for will review it manually. After further review, the final decision of an underwritten Medigap application will either be that you are approved or denied coverage. Now, if you're denied enrollment into the new plan due to something reported by Milliman, although it may be time consuming, it may still be possible to appeal this decision if you feel your medical records are incorrect. Now, in this case, you can request your report directly from Milliman to see which condition you're being declined for. If you feel the report does not match your actual medical records, you should then contact the doctor who made the reported diagnosis. Then, if it was made in error, they can directly try to correct this with Milliman and their system. Then, after all of that is done, the Medigap insurance company that originally denied you can reconsider its decision once they see the correction has been made in Milliman's system. However, if you were rightfully denied enrollment into the new Medigap plan due to your health records, and there's not an alternative company that may have different health standards for you to apply for, you will likely find that you have to keep the current Medigap plan you have, which highlights the importance of not canceling your current coverage before applying for the new plan like we talked about. Now, on a more positive note, if you are approved for the new Medigap plan, it is important to confirm the new premium rate you are approved at. Some companies, they may have standard premium rates or a preferred premium rate, which could be the difference of $20 to $30 or more per month. So it is important to confirm that you are approved for the preferred premium or that you're comfortable with the new premium before you're canceling your current Medigap coverage. When it comes to canceling your current Medigap plan so that you can transition from one to another, you can do this by calling your current Medigap company to cancel your coverage, but we do also recommend submitting a cancellation request in writing just to be sure. On the screen here is a sample cancellation letter provided by United Healthcare that you can use as an example, and we will link to a PDF of this below. Just know that some Medigap companies, they may ask you to complete their specific cancellation form, and some could require a cancellation request be submitted 30 days before the actual cancellation request date. Like always, confirm the specific cancellation process directly with your current Medigap insurance company to ensure it is done correctly. Regardless of the method, make sure that your requested cancellation does not leave a gap in your Medigap coverage. For example, if you're approved for a new plan on June 1st, make sure your current Medigap coverage does not cancel until the very end of May. Okay, let's round things out by giving you some overall pro tips to think about when it comes to changing Medigap plans through the underwriting process. First, make sure you give yourself enough time when applying for a new Medigap plan. This means if you want coverage to begin August 1st as an example, don't just rush to apply for a new plan during the last few days of July unless you absolutely have to. Although automated underwriting may be possible, it can still be good to give yourself 2 to 3 weeks or longer for an underwriting decision to be made. Now, this is especially true during the annual election period from October 15th through December 7th, when more people are changing plans and therefore slowing down the process for everyone. Another pro tip comes from the question that we often get from clients that want to change their Medigap plan during the year. And that question is, what happens to my deductible? More specifically, this question applies to those enrolled in a Medigap Plan N or a Plan G, which does not cover the Part B deductible, which in 2024 is $240 for the calendar year. So what happens to you if you have one of those plans and maybe you've paid that full $240 for the year, or maybe you have paid a portion of it like $125 and you want to change from one Medigap plan to another, but you're worried you will have to start your deductible payments back from zero. 0. Well, thankfully, the Part B deductible, it is tracked by Medicare and it is not connected to your specific Medigap company. So if you do change from one to another, your Part B deductible progress will move with you. This even applies if you're moving from a Plan F to Plan G or a Plan N, and your Part B deductible was already paid by your Plan F. Also, keep in mind that changing your Medigap coverage, it does not have any impact on your Part D prescription drug coverage throughout the year. These are completely different coverages and policies. Lastly, remember that medical underwriting, it is not something that you only can try once. Your health and or a company's medical guidelines can change. Maybe enough time will pass when you are cancer-free or you no longer have an illness you had in the past and you want to then apply for a new plan. Or maybe a Medigap company may allow a condition that others did not in the past. Or possibly even more drastically, the laws in your state change in the future and you will have the chance to change to a new Medigap plan without medical underwriting. In recent years, we have seen this happen in states like Idaho, Oklahoma, and Kentucky, which have recently introduced birthday rules, which we also discussed in our previous video. As always, please make sure to subscribe to our channel for future videos so you can stay informed about the changes in the Medigap market when they happen.